Okay, welcome everyone. Thanks for joining. Really super excited to talk about this topic today. Libido, pleasure, intimacy, and that's wrapped around with perimenopause. There's a lot to talk about. And I think if you're joining this and if this topic you found it relevant, it's because you maybe been feeling something is off, and maybe you're feeling more tired and disconnected and just off in ways that you can't really explain. And by the way, that's okay because all of us are feeling that way, so you're not alone. And oftentimes we go through this feeling and think it's, what, we're working too much, stress, and not getting enough sleep, and all of the above. And all of the above is right, but it also can be very much perimenopause and hormone playing tricks on us. So we want to understand that why our body feels the way it is, and we want to kind of talk about libido, for example, is very much the one of the experience that women in perimenopause is going to be having. So that impacts also relationship, our confidence, a lot of different things. So today we want to bring an expert, Dr. Sadaf Lodhi, to really unpack this experience that we're having and dive into science-led understanding of why this may be happening or what is happening. And then, what can we do about it at the end of the day? So we want to talk about that. Just a quick 2 second on Nabi. We're the sponsor of this webinar. Nabi is a wellness startup. We're dedicating supporting women going through perimenopause and perimenopause specifically because it happens as early as 30s, and we're going to be in perimenopause for about 10 plus years. So we want to bring education, holistic science-backed solutions so that we can actually really take control of what is happening. And our mission is to empower all of us women to navigate this transformative phase with confidence and knowledge. And so we can thrive at the end of the day. We believe that we're all very powerful, and then there are things happening, regardless we like it or not. But there is a way that we can navigate and manage the symptoms and how we feel. Quick PSA for this group. Everything we're discussing is for educational purpose, should not be taken as individual medical advice, but please feel free to ask questions. And we want your questions. So please either put it in the chat, feel free to just come on and ask. And we will be recording this session. We are already. And we will be sharing this recording through email. So if you want to just go back and be like, you know what, that was something that I heard that was interesting, you can absolutely go back. And also you can feel free to share with someone, other peri babes in your life, so you can share the knowledge. Sharing is caring. So with that, let's jump in. So Dr. Lodhi, wonderful to have you here. And if I may, just do a brief introduction, but feel free to add on more because you are like women of many things. But you are a board certified OB-GYN, sexual health expert. You also have founded a Femme Vie Health, a concierge practice dedicated to personalized women's care. You're also the host of the Muslim Sex podcast, where you've been doing this for quite some time, breaking taboos, tackling often, this very uncomfortable subject, if you will, and the realities of sexual health and wellness. With over 2 decades of experience, you're on a mission to empower women with knowledge and solutions. So welcome.
Thank you so much for having me. Thank you to Nabi for this webinar. I think it's going to be really educational, and I hope that people find a lot of value from this webinar. So thank you for having me on.
Great. So let's just get right into it. So starting with the foundational, because I think with anything they were talking about, let's like ground ourselves. It would be great to start with foundational definition for what is perimenopause, doctor, and talk about how hormone fluctuation, which is actually characteristic, and you can talk to us more about that, or what makes perimenopause. What is happening during this time that is impacting eventually our libido and our sexual desire and response?
Yeah, that's such a great question. So perimenopause is the transitional phase before menopause. So we know that menopause is the time in our life where we go a whole year without a period, right? And so the time before that is perimenopause. And we also know that from the SWAN study that was conducted in 1994, is still ongoing. It was a study that was a multi-center study, and it looked at women through midlife and looked at different aspects of their lives through midlife. And from that study, we found out that different ethnicities go through perimenopause for different lengths of time. So, for example, we have Caucasian women that go through perimenopause for about 7 years, Asian women, such as Japanese and Korean, for about 5 years. We know that African Americans tend to go through it for the longest period of time, which is at 10 years, and Hispanic women for about 8.9 years. And Southeast Asian women, they think about 2 years longer than Caucasian women. So again, about 9 years. The reason why that's important is because if we're thinking that menopause, it happens around 51, 52 here in the US, barring, any type of medical issues that you've had, like say, for example, if somebody's had breast cancer or had some type of surgical menopause, the age for natural menopause is around 51, 52. And so if you subtract those years from that, you can kind of gauge around the time when you might be going through perimenopause. And of course, genetics plays a part into it. And so that's also important to know, like around, how old was your mom when she went through menopause, and then subtracting that time frame to know, whether or not you may be in it. And like you said, EJ, some women can even start to go through perimenopause in their 30s. So really important to know what it is. But of course, this is where estrogen and progesterone fluctuate unpredictably. So if you were to imagine like a roller coaster, right? That's kind of what your estrogen is looking like. It goes up and down and up and down. And so that delta between the really high estrogen and the really low estrogen is what's causing our symptoms. We know that we have estrogen receptors throughout our whole brain, from our head to our toe. And so that's why we see so many different symptoms come about. We have symptoms that impact our mood because we know we have estrogen receptors in the brain. Dr. Lisa Mosconi does a lot of research through Weill Cornell on the menopause brain, and she even wrote a book on that. And she talks about what happens and how the estrogen receptors are even lit up until the age of 65. Looking for that estrogen, we know that the hippocampus, the amygdala, the hypothalamus, all of them, are definitely impacted by the decrease in estrogen, which results in our fluctuations in our mood, our energy, and definitely our sexual health takes a little hit as well. We notice around this time that we may be experiencing a decrease in libido. We know through the Preside study, which was a study that was done, it was a questionnaire that was sent to thousands of women throughout the US. And what it noted was that women in midlife, right? So they define midlife in their cohort as like in their 40s through their 60s. Women in midlife tended to have sexual dysfunction, and that ended up being around the time when women tended to experience sexual dysfunction the most was in midlife. And about 44% of women will experience some type of sexual dysfunction in midlife, and about 12% of women will experience some type of distress with it. So it's really important to understand that this does happen, and this sexual dysfunction, this decrease in libido and issues with our sexual health start to creep up in midlife. And, it's also due to decreased swings in our libido, vaginal dryness, sometimes pain with sex, changes in the sexual response. All of those things can be responsible for why we feel things are a little bit off, why our libido changes. Some days you may feel a little bit disconnected with your partner, and that's normal, but your partner may not understand that unless you explain that to them, right? And because these hormones in perimenopause, kind of fluctuate like this roller coaster, sometimes our moods can also, change pretty quickly. And so that's why desire can also feel a little bit unpredictable. Stress, sleep also can definitely affect how we feel, how our mood is. If we're not sleeping, like, for some women, they start to experience hot flashes and night sweats during this time. And so their sleep is absolutely disrupted. And anytime you are exhausted, you're not going to want sex. Your libido is definitely going to take a hit. And so, your relationship dynamics may change at this time. The important thing to know is that this is not a permanent phase. Things can definitely change. And I think what's great about this webinar is that it's all about education. It's about empowerment, and it's about learning, the changes that are happening in your body so that you can take action and that you can see when things are a little bit off and definitely go and seek help.
No, thank you so much. And keep bringing some of these, books they recommend. For the participant here, I dropped the Dr. Mosconi's book, love her. love her work. So if you are not familiar, I just dropped the link this chat so you can check her out and then her work. It's just absolutely fascinating. So thank you for mentioning that. You talked about stress, and obviously we hear that all the time, but what about like birth control? Because what's different about perimenopause and menopause is that perimenopause, we're very much still menstruating. Of course, we go through sometimes regular, irregular, depending on what stage you are. So cycle could change a bit too. But, many of women in peri are still very much on, for example, birth control, maybe anxiety medication, antidepressant. So a lot of these things come up, and do they impact the libido as well?
100%. So many medications we know absolutely affect libido. In fact, there was an article in the New York Times that talked about this, how that was last year, I believe it was in March, where it talked about libido and birth control pills and how absolutely birth control pills can affect that. And the way that that happens is that with birth control pills, because they are pills, they go through what's called the first pass effect, which is through the liver. And what happens there is that you have an increase in sex hormone binding globulin. So if you think of sex hormone binding globulin as kind of like a Pac-Man, right? And if you think about the free testosterone in your body just kind of floating around like those little goblins that you see in Pac-Man, I don't know if people are familiar with Pac-Man, but that's kind of a analogy that I use. And so if you imagine that the sex hormone binding globulin kind of gobbles up that testosterone, right? And so you have that less free floating testosterone in your body. And so we know when there is low testosterone in our bodies, our libido goes down. And so that is how birth control pills will affect libido. Birth control pills also affect the hormones in our body. And so they will also affect the vulvar hormones that we know there's estrogen, testosterone in the vulva, and they can cause what we know as hormonally mediated vestibulodynia. So basically, they can cause a little bit of irritation in the vestibule, which is the entrance to the vagina in the vulva. And so when you have that, and if it's causing pain, so if you're having pain, and in fact, I just saw a patient today in my office, a young girl that was experiencing pain, and she had been on birth control for a really long period of time. And so, we know that birth control is amazing for so many things, right? For cycle control, especially in perimenopause, when the periods are, can be absolutely like crazy and can be fluctuating. And some people can have like heavy menstrual bleeds and things like that. So, birth control pills are so essential to help manage that and also to kind of stabilize the hormonal fluctuations that we're having in perimenopause. But it's also important for us to know that they do absolutely impact desire. They can also cause a little bit of pain with intercourse. And so if you notice that, be aware that birth control pills can affect that. Absolutely. And antidepressants, well, specifically SSRIs, SNRIs, what those are like, Zoloft and Prozac and things like that, medications like that they can affect your orgasm, but they can also affect your libido, right? So anything that increases serotonin, so what we call serotonin reuptake inhibitors. And so if you have increase of this neurotransmitter called serotonin in your brain, then you are going to have decreased libido. And that's what will happen is that you will have an increase in inhibition. And so, because of that, a lot of women that are on antidepressants will experience decreased libido. And that's why that's so important. It can also dull the sexual response and arousal. It can decrease the dopamine, and dopamine is what will increase the excitation. It's a neurotransmitter in the brain that will increase the excitation that helps with libido. And so, with these antidepressants, sometimes some of them can absolutely affect your libido by increasing certain neurotransmitters that will increase the inhibition and decrease the excitation. So basically, what I'm explaining is that there's something called a dual control model in sexual response, and it's kind of like a seesaw. Right. And if you've ever read that book called Come As You Are by Emily Nagoski, she talks about the brakes and the accelerators. She's basically describing this dual control model. And the seesaw has, things that will cause excitation and things that will cause inhibition. So if you have more things that are causing inhibition, it's going to not want you, it's going to make you not want sex and decrease libido. If you have things that increase your excitation, for example, medications that increase that excitation or increase that dopamine, then you're going to be more likely to participate in some type of sexual intimacy. So what you want to go for is something that decreases your inhibition and increases the excitation. That's where that seesaw analogy comes into, and that's what that dual control model is. Stress can also absolutely affect your libido. Chronic stress plays a major role in increasing cortisol, which disrupts your sex hormone and can definitely dampen your desire. So those are the ways that, different things can affect it.
Another book, I dropped it when you said it. So if anyone wants to check it out. When you're when the patients that come to you and when the libido department is just not quite there, how does that actually like do one like really realizes is that they kind of contribute to something else? Do they usually kind of how do they land it? I guess I'm trying to understand like what's the sort of the indication for them to like, you know what, I think I have a problem with the libido department, but how can a woman, based on what you've seen, tends to arrive there, or like where do they start when they know that
Yeah.
something's off?
Yeah, absolutely. So, that is a great question because again, when you look at that Preside study that happened, that questionnaire that they had for women, and asking them about sexual dysfunction, what you noted was that about 38% of women experience decreased libido. And that was, so when we looked at sexual dysfunction, we looked at, libido, arousal, orgasm, or any type of sexual dysfunction. And what they notice is that the number one type of sexual dysfunction that women came in for was libido. And it was about 38% of women. And of those women, 10% experienced distress, that their libido was low. So, I think that perhaps one of the questions that you were asking is that how do you know if you have a problem with this? And what women will come in with is with distress, right? So if a woman has um, decreased libido, like she just doesn't want to have sex, she's not interested anymore, whatever, if it's not causing a problem for her or her relationship, that's really not a problem, right? It's when that problem, when that decreased libido starts to affect her relationship, when it starts to affect her self esteem, how she feels about herself, how she sees herself as a sexual being, then it definitely is a problem. And that's oftentimes when patients will come in and seek help. So I've had patients that have come in and talked about this libido. And what I think is so fascinating about libido, and it's not a conversation that can be had in like 5 minutes, right? So as you see your gynecologist and as you're talking to them, at the end of your pap smear or whatever, you say, oh, by the way, I have issues with my libido. That is like a whole can of worms that you need to kind of untangle and figure out like what's going on. So anytime when somebody comes in with decreased libido, I start with the biopsychosocial model. In sexual medicine, we always talk about the biopsychosocial. We talk about anything biologically that can be affecting libido. So for example, if you're having pain with sex, right, that absolutely will affect your libido. You're not going to want something that causes pain. And in fact, again, Emily Nagoski, I love her, she talks about to want sex is to have sex worth wanting. So if you are participating in something or if something is causing you pain, you're really not going to want it. And that is absolutely going to affect your libido. And so we look at things biologically, right? So if you have vestibulodynia, if you have vulvodynia, if you have any of those pain things, tight pelvic floor muscle, vaginismus, any of those things causing you pain in the end organ, you're definitely not going to want it, right? Then again, you go to the psychological component. So if you have anxiety, depression, or meds that you're on that are for anxiety and depression, and those are blunting your orgasm or it's causing you to have decreased libido, you're not going to want it. And then the social aspect of it, right? So for example, if you were raised in sex negativity, or if you have you experienced like trauma or abuse, that's going to affect your libido. If you haven't had like therapy or haven't had the opportunity to work through those things, that will absolutely affect your libido. Also, if you are a single mom that's working multiple jobs, and then sex is then just another thing on your list of things to do, you're not going to want it. When sex becomes a chore, then nobody likes chores, right? Nobody, I don't like chores, that's for sure. But so, when sex becomes a chore, you're not going to want it. If you are not getting anything out of that encounter, so for example, if you're having, intercourse with your partner, and you're not able to orgasm, or you're not finding any type of pleasure in it, right? It doesn't always have to be about orgasm, but if you're not finding any pleasure in this encounter, you're not going to want it. So, all of those things can absolutely affect your desire and your libido. Changes, right? So changes, like we're talking about perimenopause changes. So in perimenopause, a lot of women will experience decreased lubrication. Right? Why does that happen? Because you have a decrease in estrogen. So estrogen is anti-inflammatory in our bodies. Estrogen also helps with blood flow. It helps to recruit blood flow. When we are going through perimenopause, you have these fluctuations, these dips, right? So sometimes the estrogen is high, sometimes the estrogen is low. When the estrogen is low, and say that, in your body that day, your estrogen is low, and say that you are trying to become intimate, you're having, with your partner, and all of a sudden you notice that you're not getting lubricated, and then you try to have intercourse, it may be painful, right? It may be causing you a lot of pain, and you may not want that. So, that's when I always tell women that there's no shame in your lube game, right? Like, you definitely want to use lubrication if you need it. There's nothing wrong with that. There's nothing wrong with you. It's just a function of what our hormones are doing. And so you want to make this experience be as pleasurable for you as possible. So you want to, be preemptive and use lubricants if you need them. So there's so many things going on during this time, and all of those things can affect your libido.
And it's so funny because that was going to be my next question. So vaginal dryness, right? That's due to perimenopause. Um, and if you were thinking about the intercourse being painful and dryness down there, and then sometimes can be quite itchy, and combination of these things, what women in peri are experiencing, that's the reality.
Yeah.
Then I was going to ask you, there are definitely different things out there, whether that is lubricant, lotions, or things like that. And I guess, what are some of the things that you have recommended, whether that's like oil-based and water-based, like, just because I have no idea like what's good for
Yeah.
you. So I just
Yeah.
wanted to kind
Yeah.
of get
Yeah.
you
Let's talk
to
about
tell
it.
us like what you've seen worked well for
Yeah.
people.
Definitely. So there are three things, right? There's lubricants, there's moisturizers, and then there's vaginal estrogen. So, where is it? What do you need? What do you do? What do you use? So, if you are looking to only use something, like, say, you haven't started to experience too much irritation in the vulva and the vagina, and you're just noticing that, when you have intercourse, you have decreased lubrication, what do you use? So there are definitely different lubricants. There's, lubricants that are silicone based. There's lubricant that is water based. There's lubricant that is oil based. You have to just kind of find the lubricant that works for you, that like, for example, some people are worried about, maybe their sheets getting dirty, right? So you want to use maybe a water-based lubricant. But remember that water-based lubricants do not last very long. They dry out. So you may want to go for a silicone-based lubricant. Silicone-based lubricant is fantastic for, it lasts a long time. They're inert, meaning like it's not going to burn, it's not going to irritate. You just don't want to use silicone on silicone. So if you're using like toys, then you don't want to use a silicone lubricant. So you want to, use perhaps like a water-based lubricant with that. Also, oil-based, there's oil-based lubricants. And so you want to know what kind of, so remember, perimenopause, women are still ovulating, they're still able to get pregnant, right? So, if that's a concern, then you want to make sure that if your partner is wearing a condom, you want to see, what type of condom they're using, because certain condoms are not good with certain type of lubricants. So always just make sure, look that up. I actually have a reel on that on my social media that you can look up and see, which condoms are good with which lubricants. But typically I like silicone lubricants because I find that they're non-irritating. They last a long time. They're silky smooth, and they just feel good on the skin. So I personally, will tell my patients to use a silicone lubricant because I find that that's helpful. So that's for sex. Remember, lubricants are really just good for sex. They're not going to help you with everything else. So if you have chronic irritation, if you're having dryness, not just when you're intimate, but just in general, moisturizers are fantastic. There's a lot of vaginal moisturizers out there. There's those that are DHEA based. There's hyaluronic acid, and that hyaluronic acid is going to plump up that tissue. They are non-hormonal. So you can definitely, hyaluronic acid is non-hormonal. DHEA can break down into, testosterone and estrogen. But, those moisturizers are fantastic for using like on a daily basis. You can use vaginal moisturizers and they will help with that irritation. I actually have a friend who's a dermatologist, and I prescribed her vaginal estrogen. And then the days that she's not using the vaginal estrogen, she uses a vaginal moisturizer. And she said for her, it's been a game changer because it's really helped her tissue. She doesn't have that chronic irritation, and it's really helpful. DHEA can also help to restore that elasticity. But my gold standard, honestly, and I will tell you why, I love vaginal estrogen. Okay, vaginal estrogen. Why is vaginal estrogen so good? Well, okay, if we think about what is the cause of this vaginal dryness, this vaginal irritation, this overactive bladder that you could be experiencing, right? Some women will feel like, oh, I went to the bathroom, but then all of a sudden I have to go again, or if they're having recurrent UTIs, oftentimes, and like some of these Facebook groups, I see that women are talking about, they're in midlife and they're saying, now I'm starting to have all of these recurrent UTIs after sex. How can I prevent this? It has a lot to do with that decline in estrogen. With that decline in estrogen, what we notice is that you have decreased blood flow to the vulvar vaginal area. That's what causes that decrease in lubrication. It's what causes that irritation. You can also notice, right, as we go from perimenopause into menopause, that that tissue texture changes. Not so much in perimenopause because you still have that estrogen, but as you move closer to that menopause phase, that tissue, and as we go further along into menopause, you'll notice that tissue changes, right? It becomes thinner. It can become easily irritated. Also, what we notice is that the vaginal microbiome changes with that decline in estrogen. The pH changes, it increases. And so when that happens, women are more susceptible to perhaps bacterial vaginosis or recurrent yeast infections. I had a patient that came to me for 3 years. So she's in perimenopause. And for 3 years, she was having chronic bacterial vaginosis, right? On and off, on and off. And she said she kept going to her doctor who kept treating her with antibiotics, and she kept getting it over and over again. And she wanted to do, and this is before, so this was in November that she came to me. And now I don't know if you noted, if you saw that article that was in the New York Times, but also in the New England Journal of Medicine that talks about bacterial vaginosis and how there was new research that was just published out of Australian study, March 5th, 2025. And it talked about this randomized placebo controlled trial where they had women that had recurrent bacterial vaginosis, and they treated them just by themselves, and then they treated them and their partner. And in fact, they ended that trial early because they noticed such a significance in the decrease of recurrence in bacterial vaginosis by treating their partner. So this was something that, OB-GYNs had always thought that BV was, came from sex, but we never called it a sexually transmitted infection. Because that connotation just makes it sound really bad, right? Like you think of like gonorrhea, chlamydia, you're thinking of herpes, and so now there's bacterial vaginosis. But we know that if we treat the partner along with the patient, that her risk of recurrence in 12 weeks is going to be definitely significantly decreased. And that's what that New England Journal of Medicine, that article just showed. And so my point in telling you this is that I had a patient that came to me for recurrent bacterial vaginosis last year. And what I did is I put her on vaginal estrogen, and I really want to do a study on this. And I'm going to see how I can get the study going. But, I want to know how vaginal estrogen prevents bacterial vaginosis. So along with, treating the partner, I'm curious to know if we replace that vaginal estrogen and normalize that vaginal microbiome, will we absolutely prevent this bacterial vaginosis from occurring? And so, actually, for my patient, I didn't treat her partner, although now I think perhaps if she has it again, I can treat her partner because I have the data behind it to back it up to treat her partner and her. But I started giving her vaginal estrogen. And guess what happened? Knock on wood, she has not had any more BV. She hasn't had bacterial vaginosis. She's like the happiest person. She's like so happy to have come to my practice and have been treated, because before that, people kept giving her antibiotics and nobody thought that because she's in perimenopause and she's having this fluctuation in estrogen that perhaps her vaginal microbiome is off. And because I knew that her vaginal microbiome was probably off, I gave her the vaginal estrogen, and so far, so good. No more infection.
So happy for her
Yeah, yeah,
because, when you're not quite happy down there, it's like it impacts everything, right? And
absolutely.
the I didn't realize that there's a study, but I just looked up while you're talking, so I dropped the link on the article. I'm sure that will take you to the actual study if anyone's interested.
Yeah.
But since you brought up the partner and you're also intimacy coach. So want to talk about the partner. When things are changing and things are just not the same, that does impact the relationship, right?
Mhm.
So what will be your sort of guidance on how to talk about this and how to bring it up? Because there's just a lot that we are even trying to digest on about our body, but then we have to also bring, somebody else if we're in a relationship. So just briefly, things that that try this or talk about it this way, or if there's any practical tip, we'd love to hear.
Yeah, and so I'm so glad you bring this up because, talking about sex, it can be really difficult. And I think that, I would ask the person to kind of think about, like, why is talking about sex so difficult? Is it because, you and your partner are not able to talk about things that are, a little bit sensitive? Does it turn into like, well, this is what's wrong with you, this is what's wrong with you, right? So open communication is really key. And you want to start by reassuring your partner that your feelings for them haven't changed, but that your body is changing and that you just need them to understand. And as you understand what's going on with your body, it's important for you to educate your partners as well. You always want to use I statements to express how you're feeling rather than placing blame. You never want to, start off a conversation by saying like, oh, you did this or you did that, but just saying like, this is how I am feeling. This is what's going on with my body. And I just need you to understand, how I've noticed that there's some changes, and I'd love to kind of explore things that feel good for both of us, right? So you want to always have these conversations outside of the bedrooms. I always say, please don't have these conversations in the bedroom. And you never want to have them right after you've had sex, right? You don't want to be like, oh, well, this is what went wrong, and this is what, because that's just going to ruin the whole mood. So you want to definitely do it outside of the bedroom. You want to do it when you both are not preoccupied. You want to put away your phones. I think that's one of the biggest distractors, right? Like sometimes I don't know if you, like, I know when I go to restaurants, I always put away my phone, and I see, just look around and I always see people on their phones, but they're like sitting at a table together, but they're not really together. They're not really conversing because they're staring at their phones, right? So you always want to make sure that there's no distractions. If you have children, try to do it when your children are either not home or preoccupied doing other things, or perhaps, hopefully when they're in bed, so that you have time to like focus on each other, right? Sometimes what I'll even do is I'll ask my intimacy coach clients to put it in their phone, right? So oftentimes when we don't write things down, they don't get done. But if you put something on your phone, then, and if you use that as a calendar or something that you look at to kind of make sure that you're accomplishing things, then if you put in your phone, then it'll get done, right? So you set aside, even if it's just 15 minutes, right? So you put it so that you know that it's a priority and they know that they're a priority for you, right? Oftentimes, I think, especially when long-term relationships, we take our partners for granted and we don't really focus on them and we don't prioritize them. And so if you set aside time where it's on your phone, And, it's a time just for you and them to talk and talk about what's going on in your relationship. I think that's helpful. Or even just taking a walk outside, right? Holding hands, showing like creating that emotional intimacy between each other, especially if things have been a little bit estranged between the two of you, or if you've been having a lot of problems and issues in the bedroom, right? You want to try to figure out ways to create that emotional intimacy again, because we know through the works of Rosemary Basson, who's created the sexual response cycle, um, that she notes that when there is emotional intimacy, people are going to be more likely to participate in physical intimacy, right? So how do you create those moments of emotional intimacy? That's when, you're holding hands when you're walking, perhaps you're cuddling on the couch, perhaps you're giving each other a very long hug, or maybe a 6-second kiss, or maybe you're, creating a meal together, doing something that you do together that's special for you, will really help to create that emotional intimacy, which will then hopefully lead to physical intimacy.
And I think all the things that you're sharing with us is kind of like it sounds like, oh, that shouldn't be too difficult because it's all something we can actually practice and we can try. But sometimes given, depending on the dynamic of the, partnership and what other life stress is happening, I think it's not always easy to try that like 6-second kiss or whatever. But, I think that these are all great advice. But for women, are there any lifestyle tips or suggestions that I think this you talked about it all past a few minutes, several minutes at this point about like, we want to sleep, we want to stress manage, and there's like other things that that from a lifestyle adjustment perspective that could actually help kind of get your groove back on, I guess.
Yeah, yeah, absolutely. So, definitely if you are experiencing low libido, or you're having discomfort or feeling pain with intercourse, you definitely want to go and be evaluated. You want to go to a sex med doc that does know about those things. I'd love to say that all OB-GYNs are trained in evaluating sexual dysfunction, but unfortunately, that's really not the case. So you want to go to, you could even go to the International Society for the Study of Women's Sexual Health. It's called ISWISH. Go to ishwish.org, and you can go to their website and find an ISWISH fellow, um, who is somebody that has taken courses through ISWISH to learn about female sexual dysfunction. I'm actually an ISWISH fellow. And so you can find somebody that really understands, libido and orgasm and all of this, so that you're not really starting from scratch and you're not having to kind of teach your, gynecologist or whoever, your family practitioner, whoever you go to, about the problems that you're having, but that they can actually be truly involved in your care and helping you to come up with solutions. Again, if you're having a lot of hormonal shifts, it's perimenopause and you're not really sure if it's perimenopause or if it's, something else, then I would go and just go for an appointment with your doctor, go through what your symptoms you're having, right? Talk about the vaginal dryness, talk about the pain. Maybe you're having problems with arousal and you don't understand that. Maybe there is some hormonal needs that you may have, perhaps if you are closer to menopause, right? So there are different stages of perimenopause. And as you get closer to menopause, maybe those hormonal shifts are really, wreaking havoc in your relationship and in your libido and stuff like that. So you want to go, you want to be evaluated. And if you need, perhaps you need some menopausal hormonal therapy, right? So that might be a solution for you that would be helpful. Maybe you need some testosterone. There are, so for libido, specifically speaking, there are 3 medications that we use. There are 2 that are FDA approved and 1 that is non-FDA approved, but has a global consensus that was created by the Endocrine Society, ACOG, ISWISH, the International Society for Sexual Medicine, and it's the International Consensus on the Use of Testosterone for Menopausal Women. And it talks about, what is the safety, what are the studies behind it. And so that talks about testosterone. We use testosterone off-label in perimenopausal women. So just, so if you're peri, doesn't mean that testosterone is off, that you can't get testosterone. You can if you go to a prescriber that knows how to prescribe it. Also, in terms of medications, right? So we have Addyi and we have Vyleesi, and those are 2 FDA approved medications for libido that you can talk to your provider about. Whether or not they are used, I believe they're used in perimenopausal women. premenopausal women and they're used off-label in postmenopausal women. How do they act? They work at the level of the brain. They increase the neurotransmitters in the brain that increase excitation in the brain. So, for example, Addie will increase dopamine in the brain. And Vyleesi acts with melanocortin. So they work at the level of the brain to kind of get a person into the mood of wanting sexual intercourse. But again, remember, libido is not just about medications. It's about, taking a look at your relationship. In fact, I just talked to a woman the other day and she told me, oh, I'm experiencing decreased libido. And I said, okay, well, let's talk about that. I said, well, what is your relationship like? And she's like, oh, it's awful. But I'm like, well, then why are you gonna, you're not gonna want to have sex if it's awful, right? So there are things that need to be kind of placed in or, put in order before I think, you can think about medications. I think that if your relationship is on the rocks, then perhaps deal with that relationship, right? Deal with whatever issues you're having. If you are not able to talk to your partner about important things like money and sex and things like that, then perhaps you start to have those conversations, right? Perhaps your partner is not familiar with the female anatomy, right? And you'd be surprised. Even sometimes women are not familiar with their own anatomy. So it's about education. It's about learning about your anatomy. It's about learning about what you like, what you don't like, right? And how to increase that libido. It's about if you're working 50 jobs, right? And maybe asking somebody for help, maybe asking somebody to, watch your kids so that you can have like a date night with your partner. So it's about kind of looking at the whole package and it's not just looking at one thing. So I think that, yes, definitely, if you notice that something is off with your libido, go and see a provider so that they can hopefully take a look at, the whole psychosocial aspect of your life so that they can figure out what's happening, what's missing, and how they can help you.
So Tia Dia, don't brush off. This is a real thing. We have to give it attention. So I have one more question, and please, ladies, if you guys have any questions, feel free to drop it on the chat, or also feel free to come off on screen or mic, unmute yourself. But I do have one last question from my end, Dr. Lodhi. So the Muslim Sex Podcast. Um, I would love to just hear why was it important for you to start that?
Yeah, so that's a great question. I don't really get asked that question too much. So, it's so the Muslim Sex podcast, I'll tell you what the whole origin was behind that. So it's funny because it came about in, let's see here, 2021, November, I can tell you, it was November 2021. And I remember a friend of mine calling me up and she's a lay person, she's not in medicine. And so she had some questions about, whatever sex and stuff like that. And then she said, wouldn't it be great if we started a podcast where I was the layperson and you were, the medical professional and you just, talked about all these things? And I said, yeah, that sounds great. That's fantastic. What's your idea? And she's like, well, I think, we need to make a podcast. And I think that we need to call it something that will get people's attention. And I was like, sure, what's your idea? So she says, we need to call it the Muslim Sex Podcast. And I said, no way. There's no way I am combining those two words together, Muslim and sex. Like that's just, it just seems wrong. I'm not going to do it. And she's like, no, no, no. But that, that'll cause people to stop and think and be like, oh, what is that? Why is it, what is it? And I said, oh, I don't know. So, anyways, it took me a really long time to kind of wrap my head around that, just that name. Because I was like, well, what about the Muslim Intimacy Podcast? She was like, no, it has to say sex. It has to say sex. And so, anyways, we created that because we wanted to break stigma. We wanted to break taboo. There is a lot of, people associate a lot of things with Muslims, right? We don't have to go into that, but definitely not sex. I can tell you that much. And, we just wanted people to understand that, there are people that are obviously faith-based, people that perhaps are Muslims that also are concerned about sexual health topics, right? And in a lot of communities, not all, right, there's a lot of sex positive Muslims. And in fact, so I'll be really quick because I know we don't have that much time, but just a little bit of background. Islam is a very sex positive religion. I myself didn't know that, to be honest. I learned that later on as I started to learn more about just sexual health and about my own religion, this and that. And so Islam is very sex positive, and there, in fact, women have sexual rights in Islam. So a woman can potentially divorce her husband if she's not sexually satisfied, which is I found like, is mind blowing, right? You never hear that, like what? But yeah, it's true. So, it's actually a woman's right to be pleasured in her relationship. And the interesting thing is that like for people that practice, for practicing Muslims, they're only allowed to have sex within the context of marriage. And so, if that's the case, then they can, if they want to find pleasure in that sexual relationship, they have to find in the context of marriage. So I just think that's really empowering for women to realize that there is actually sexual rights for women in Islam, and of course for men as well, but that it's their right to have pleasure in that relationship. And so with that thought, I know that there's a lot of just not only Muslims, but other people of like very strong faiths, but specifically Muslims in this case, that don't know that history. They don't know that Islam is a very sex positive religion and that it's a woman's right to have pleasure in her relationship. And I wanted that to be known. I wanted women to feel empowered with education, and I wanted to break the stigma. And I also, there's a lot of times in very conservative cultures, we have a lot of sex negativity. So I wanted to break that cycle because I wanted the next generation, right? So if I didn't get it, I wanted that next generation to have empowering knowledge. I wanted them to be sex positive. I wanted them to then continue that with their children and have more sex positivity, right? And I think that when we have that sex positivity, we're able to have these conversations, these type of conversations, that we're able to know that, it's not wrong to learn about sexual health. It's not wrong to learn about my anatomy. It's not wrong, shameful, dirty. These are not things. This is sexual health is part of health. It is a natural part of human life, and that we should learn about it. And it's not wrong to learn about it. And so I've really kind of owned it. So it is my podcast. And actually, somebody most recently suggested that perhaps I change the name. She's like, well, maybe people just feel like it's for Muslims, it's not for anyone else. And I said, that's a very good point. But the community that initially I wanted to help kind of move forward, I feel like that would be lost if I changed the name. And it would kind of not be like, because there's a lot of sex podcasts, right? That there's like, You Are Not Broken, there's Sex with Emily, there's tons of sex podcasts. So if, for the layperson, for anyone that wants a podcast on sex, they can go to so many, and there's lots of good,
Yeah.
podcasts.
Hmm.
But if you just, for these individuals, I wanted them to feel like there was something created for them.
And kudos to you for owning it. And I think that's something that we see a lot in our community too, that women, especially in Perry, and they're owning it. And I think when we own stuff, that beautiful things happen. So stick to it. You've been doing it for a while. And what we really do admire about you is that you really look at women through that diverse lens. And, first of all, like I'm South Korean, like we growing up, I mean, we didn't talk about sex. So it's like a foreign topic. So there's a lot of education, and I'm sure I'm not the only one who feel that way, that we don't have a lot of education. But all right, would love to open up to see anyone, any questions for Dr. Lodi that you would like to ask, or just because you're curious. Anything? Feel free to unmute yourself if you like, or you can drop it in the chat. And by the way, I've been like dropping a lot of stuff in the chat as you've
I
been
see that.
mentioning all the studies, and I'm really proud that I was able to do both. Anything, anyone? I mean, hope this was helpful. I mean, I know there's a lot of information, but anything? Wanda, Florencia, Sandra? No?
I just want women to know that there's always hope, right? I want women to know that if they're struggling with their libido, that they're not quite sure what's going on, I want them to walk away knowing that there is help, there's hope, and that you just need to find the right person if you haven't found them. There's the American Academy of Sexual Educators, Counselors, and Therapists called ASECT, which is a great resource if you're looking for a sex therapist, if you're looking for a couples therapist. You can also find somebody there. Like I said, I really think that it is a multi-faceted approach when it comes to libido and perimenopause. And so you really need to find the right fit. And it's always helpful to have therapists because they are, so
Yeah.
important when it comes to unraveling
Yeah,
things in our past.
and I think that generally practicing healthier sex life is actually going to be good for all of us. So that's something that things we even if you don't feel like I have problem right now, maybe we will get to that point of something feels off, and we just want to know that, or if our girlfriends are having some of this issue, hopefully that now that we heard you, we learn a bit more about this issue from you. We have a bit more of the insights and knowledge that we can share. So yeah, thank you so much for that. And we do need to create more opportunity to educate each other and let the good knowledge and all this like great resources to be socialized. So Dr. Lodi, thank you so much. I know you had like so many things going on this week. Really appreciate it. And thank you, ladies, for joining. And yeah, we'll share this as a full recording. And also, we'll plan on taking some of the important parts and share it in our social nabi.life on Instagram. Nabi with two N. By the way, Nabi, for those of you who don't know, means in Korean butterfly. So love, hope, beauty, transformation. And today's also first day of spring. So hope everybody's, reset and re-energize and have a wonderful rest of March and beyond.
Thank you.
Alrighty.
Thank you.
Thank you.